afternoon and welcome everyone. My name is Tina Cordova and I'm the Director of Events for the Elizabeth Dole Foundation. We are really excited to have you here today and thank you for joining us. On April 22nd, we hosted our first webinar on sleep solutions and the amount of interest and questions we received was unprecedented, which is why we're really excited to host today's follow-up session, Q&A, Sleep Solutions for Veterans and Caregivers. Today's entire program is dedicated to answering the questions that you asked. I want to take this minute to thank our partners and sponsors of this program. Panel today, joining us from the Dr. Will Pigeon is one of our sleep experts, the director of the VA Center of Excellence for Suicide Prevention, Dr. Daniel Gottlieb, Chief of Sleep Medicine at the VA Boston Healthcare System, and our tech expert today, Kevin Dorsak, BMM Channel Marketing of VA and Sleep Respiratory Care. Welcome, gentlemen. Before we get started, I'd like to mention to all attendees that this is a recorded broadcast. If you need closed captioning today, that feature can be found in the toolbar section of the Zoom webinar down below. Let me go ahead and get started. Oh, I'd also like to mention that today's broadcast is recorded and it is a Q&A session, so please use the Q&A feature in the bottom of the toolbar to submit your questions throughout the program. So I'm going to go ahead and get started with a question that we received from last week's, our last episode. I'm going to go ahead and kick it off here. Can you tell me the root for insomnia? So that's a really broad question. I'm going to go ahead and throw that out there.
Yeah, so I'll give a broad answer to begin with and then get a little bit more specific. So broadly, stress is the #1 precipitator of insomnia, but stress broadly defined. So that could be something that happens in a day. It could be something that happens over weeks. It could be even something positive like an upcoming wedding, upcoming exams that begin to alter sleep and can cause insomnia. It can be a medical condition that's new. It could be a new medication that impacts insomnia. So something that stresses you as a person or potentially stresses the sleep system is the initial cause for most insomnia. I wanted to broaden the answer beyond that because another question is, what is the cause of insomnia continuing after these stressors are in place? And that's a good question because often the things that cause insomnia initially resolve and we're left with, well, it's gone. Why is insomnia continuing? The answer to that question is because other things have taken over. And many of those things have to do with us and what we're doing and things that can be addressed. Over.
So much for that answer. Our next question. My husband has a hard time sleeping. They have given him melatonin, but that does not work. What are other natural options we can try?
So there are a few additional natural substances that can be taken that have any large effect on sleep. For a few years, there's been information about drinking tart cherry juice, but its effect is fairly minimal. I don't know if anyone else on the panel has some ideas about other supplements that are sleep enhancing.
I wouldn't say supplements, but other things that are non-pharmacologic can be helpful. So for instance, keeping regular sleep habits. So, a regular rise time in particular, other things that can help are exercise, particularly in the late afternoon, early evening, appears to be the best time to help with sleep at night. Relaxing bedtime rituals can be very important to create a state in which, which the body's ready for sleep. So, so those are all things that can be beneficial that are natural.
Thank you so much. Our next question. My doctor is changing my meds to try a different medication for the next 6 weeks. How can I best prepare for the changes in new sleep with the new meds?
It's a little hard to know just what is this referring to a medication for sleep or some other type of medication? I don't know that I can offer a general answer to that question.
Why don't we sort of alter this question to say, just in general, when you're switching medications, are there any best practices?
Well, I think it really depends on the medication. You need to discuss with the physician recommending the changes. There are some medications that should be tapered down while others are, gradually increased. But it's very dependent on the individual medication. I think you need to discuss that with the prescribing physician.
Thank you so much, Dr. Gottlieb. I know that was a tricky one. Next question. In the last episode, you mentioned that monitoring devices like Apple Watches might not be accurate. Do you know if they are improving technology?
Well, I think that there are a lot of these devices, and they are changing all the time. I think there is now some increasing research on specific devices. So I think they are improving, but I don't have a particular device certainly that I would recommend at this point. And I think a broader response related to the use of these devices is that I think that many of them are very good at identifying periods of activity versus rest. Not so good necessarily at identifying sleep versus rest. But oftentimes I have patients who tell me that I ask them, how's your sleep? And they say, well, my watch is telling me this. And I want to know, well, what's your perception of your sleep? How do you feel? And I think that's probably more important than what the device is telling them for most things.
That's a good tip. Let's see. Our next question. Regardless of when I go to sleep, I consistently wake up at 4 a.m. and end up tossing and turning. I've tried going to bed earlier and it doesn't make a difference. What do you recommend?
So I am going to throw out a couple scenarios. So one is if you need about 7 or 8 hours of sleep and you're in bed for 7 or 8 hours, you're getting the amount of sleep that you need, but the problem is you're waking much earlier than you would want. And you've already tried, as you've said, going to bed later and you're still waking up at 4 a.m. The first thing I would say is ask you is how long did you try that? If it was a night or two, I would keep plugging away at that approach, going to bed an hour later, hour and a half later than usual, and try that for a week and see if there begins to be a shift to 4:30 wake up or 5 o'clock wake up. That's the first thing. Secondly, you could also make sure that in the evening, early evening, that you spend some time outside. So light is very good for us. It helps regulate our biological rhythms in addition to our sleep cycles. And some exposure to light for someone like yourself who's waking up too early, exposing yourself to daylight, to sunlight in the early evening could be beneficial.
Yeah, I would just add to that in particularly, in the summer, I think that approach works well. In the winter, when it's dark at 4 in the afternoon, not so effective. And in that setting, a light box that provides light at appropriate wavelengths, used in the evening hours, can help to delay your body's internal clock so that you can go to sleep later and stay asleep later.
Thank you so much. This next question, I'm going to send Kevin's way. My veteran suffers from PTSD. How can they more comfortably wear a CPAP machine?
Yeah, great question. For those of you that were part of the call last time, we kind of showed you the old technology, right? I think a lot of people that aren't familiar with sleep apnea might have a perception of what it is or what it was. So in our last presentation, we showed you a lot of big, bulky masks, right? That really could add to claustrophobic for these types of patients. And as manufacturers, there's many new masks out there that really restrict and open up the eyesight of patients, right? Less restrictive masks, they're softer, they're more comfortable, they're less obtrusive, and really open up and give those patients a better feel of openness as opposed to claustrophobic. So that's one of the things. I know a lot of patients will actually wear their mask and turn on the machine prior to going to bed. They may actually do a little bit of reading, watching a little bit of TV to get acclimated to their therapy. So to make it a little bit more comfortable. And a lot of these devices too also have ramp features, right? So it allows you to get to sleep at a lower pressure setting, so that it's easier to get to sleep. And then as you fall asleep, the device will kick into the prescribed pressure that you need. So there's a lot of different things that people are doing to make the devices quieter and smaller, and the mask softer and easier and less bulky to really help these types of patients that may suffer from PTSD.
Thanks so much, Kevin. Our next question is, I spend so much time worrying about my veteran going to sleep that by the time they're asleep, I'm wide awake. How can I improve this as a caregiver?
Good question and a tough situation. So something that Dr. Gottlieb mentioned earlier could apply here, and that is to essentially try to reset yourself to prepare for sleep. Difficult if your veteran is going to bed and to sleep quite late, but nonetheless, removing yourself from the bedroom or sleep environment for some time, a half an hour, 45 minutes, and finding a way to wind back down so that you're prepared for sleep of your own.
That's a great tip. Thank you. Our next question. I suffer from diabetes and am required to drink liquids all day long, and therefore end up waking up in the middle of the night to go to the bathroom all night long. What can I do?
I'm a little surprised that the recommendation would be to drink so much liquid. If the diabetes is in reasonably good control, I mean, the reason that people with diabetes make a lot of urine is generally that there's sugar being spilled in the urine, and that takes water with it. And if the diabetes is in reasonably good control, I don't think that in most cases it will be necessary to drink such large amounts of fluid. Certainly I would discuss that with the physician treating the diabetes, but I think it should be safe in most cases to stop drinking liquids within 2 or 3 hours of bedtime. And that should give you a chance to get rid of that excess fluid and hopefully not have to wake up so much at night.
That's also a really good note. Checking with your personal doctor can always be the first stop for a lot of these. Our next question. I have tried Ambien and Lunesta, but both medications come with risks. Are there contemporary sleep aids that work without side effects?
Well, I think that any medication is going to have some risk of side effects, there's no, there's no magic in that regard. However, I think that in thinking about treatment of insomnia altogether, there are non-pharmacologic approaches such as cognitive behavioral therapy for insomnia that are free of side effects and work as effectively or more effectively than medications and over a longer period of time. So I think that's the approach that we would generally recommend. But there won't be any medication that's entirely free of the risk of side effects.
That's right. And Tina, I would add that if there are folks joining today that didn't join last week, to restate what Dr. Gottlieb just said, it's called cognitive behavioral therapy for insomnia. You can ask a provider about getting a referral to get it. And to also mention to folks that there is an app called Insomnia Coach that is free that if you're someone who can do things and self-manage on your own, provides this very intervention on a phone-based application.
Thank you both, doctors. Those are really good answers. Our next question is, I have sleep apnea, but I can't get back to sleep after the machine blasts air after an apnea event. Are there any other options you recommend?
Yeah, so I think that one thing to look at is why this sensation of the blast of air is happening. It may be that often our CPAP machines nowadays are set to provide pressures within a range of pressures, and sometimes they're set to a very wide range, and it may be that most of the time the pressures that are required are lower, and occasionally they bump up to a very high pressure, in which case narrowing that pressure range may be helpful. I think another but if it's not an issue of the specific pressure settings in the machine, but simply that when you wake up, you're aware of the pressure and it makes it hard to get back to sleep. The ramp feature that Kevin mentioned is one that can be reset on awakening, and that can be helpful for returning to sleep. If, on the other hand, you wake up for whatever reason and it's hard to get back to sleep, it may be that getting up and getting out of bed for a short period of time, doing something relaxing, whether it's sitting and meditating or reading until you're feeling drowsy again, may make it easier to go back to sleep. And again, using that ramp feature if the pressure is an issue.
Yeah, I was going to just, I'm sorry, I was just going to say one thing as well. I think, a lot of times as patients change, whether you gain weight, lose weight, take different medications, your sleep may change a little bit. And we know that there's different types of devices out there for different patient needs, whether it's neuromuscular or central or mixed sleep apneas. And there are specialized devices that kind of help with the special algorithms that you may need for your special type of sleep apnea. So like anytime, consult with your doctor, make sure that you're conveying to them these type of changes. And maybe it's a change in pressure settings. Maybe it's a change of you've now progressed to a different type of device that could take on these central sleep apneas a little bit differently with the algorithms that are out there. So I think the first rule of thumb is that whenever there's a change, consult your doctor, consult the VA center that you received your therapy from, and see if they have any additional recommendations to make sure that they can look at your sleep patterns and see if there's anything changed or any adjustments that need to be made.
Yeah, and I think it's worth mentioning that with most of the contemporary machines, the information about the pressures that are being delivered and the breathing pauses that are occurring are accessible remotely. And so that allows us often to look at what's going on at night and help figure out what changes might be appropriate.
Thank you all. Those are really enlightening answers. Our next question, what causes night sweats? And are there ways to prevent it from happening?
Well, this is a tough one. And since no one else is jumping in, I will try to answer it. I would have to say that most often the cause of night sweats ends up not being clear. There are certainly some medical conditions that can cause it. There are environmental things that can cause it. Certainly being in a room that's hot or wearing, bedclothes or blankets that are too, heavy, can be an issue. There are some common medical conditions. Certainly menopause can be associated with not only hot flashes, but also with sweats occurring at night. There are obstructive sleep apnea is often, often patients with obstructive sleep apnea have night sweats as a complaint, and sometimes that will improve with treatment of the sleep apnea. Overweight can be associated with night sweats, and in that setting, maintaining a healthy weight or weight loss can be helpful. There are a number of serious medical conditions that can be associated with night sweats, and including endocrine conditions and and occasionally some types of cancers. And so I think if you have night sweats that are a new phenomenon, it's worth discussing with your physician. But most often it's a benign condition. And treatment is quite difficult. I think if there are environmental things, certainly keeping a cool bedroom, light and breathable bedclothes, breathable mattress can be helpful. In some cases where medications are associated with night sweats, for instance, some antidepressant medications have been reported to be associated with night sweats. And it may be that there are certain types of medications that can prevent that side effect. But there's no general answer to how to treat night sweats, and often it's a very difficult problem to manage.
Okay. Our next question is, how do I get rid of recurring nightmares?
You're muted. Will, you're muted.
Thank you. Two fairly effective treatments for nightmares. One is medication, one is a non-medication approach. The non-medication approach, which you'd have to ask your provider about and get a referral, is called imagery rehearsal therapy. It's a technique that is taught to you and can be helpful with decreasing those nightmares. The other is a medication. It's called prazosin, Prazosin, and that again is something you can speak with your provider about. And both of those can be effective in decreasing nightmares and the intensity of the nightmares.
Those are really great answers. Our next question, what are the alternatives to CPAP for sleep apnea issues?
Well, there are a number of alternatives. One that I think ought to be recommended to all patients with sleep apnea, even if they are using CPAP, are some behavioral measures. Certainly weight loss, if one is overweight, can be very helpful. Exercise not only can it help with weight loss, but appears to reduce the severity of sleep apnea, even independent of weight loss. And then in some patients, in many patients, sleep apnea is more severe when sleeping on the back than when sleeping on the side or in the prone position. And so sleep position restriction to avoid sleep on the back can be helpful. And avoiding substances that can worsen sleep apnea, in particular alcohol, within the last several hours before bedtime can relax the airway, the muscles in the upper airway that hold the airway open, and that can worsen sleep apnea. So reducing alcohol consumption can be helpful. So those are things that you can do without a physician's intervention. Other specific treatments aside from CPAP include oral appliances that hold the jaw forward. When the jaw is pulled forward, that pulls the tongue forward, and that creates more space in the back of the throat and can improve sleep apnea in many patients. It requires that the teeth and gums be in good enough condition to hold the jaw forward without loosening the teeth. So that will limit its use in some patients, but that may be an option. There are a variety of surgical approaches that have been taken to treating sleep apnea. The most common ones involve removing some of the soft tissue in the back of the throat, particularly the uvula, that thing that hangs down in the back of the throat, and part of the soft palate, the muscle that it's attached to. That can be effective in some patients, particularly patients with milder sleep apnea. There are surgeries that involve skeletal modifications that involve cutting the jaw and advancing the jaw forward, and those can be very effective, but of course it's a more involved surgery. And then the newest surgical technique is something called hypoglossal nerve stimulation. The hypoglossal nerve is a nerve that stimulates the tongue to hold it forward. and when we breathe in. And this is a procedure that is like a pacemaker for the tongue, so that each time we breathe, it triggers the tongue to contract, and that can be helpful in a fairly limited range of patients, but occasionally it can be an appropriate intervention. However, it does involve a significant surgery, which often patients are not aware of when they come to talk to me about it. Let's see. Unfortunately, there are no medications that are currently approved for treatment of sleep apnea. There may be a few that are in the pipeline, but I think they're probably at least a few years away before there are any effective medications available. I think I've covered the gamut of things that I can think of.
That was really informative. Thank you. Okay, our next question. My veteran's PTSD is a significant factor in my inability to sleep, or nightmares, anxiety, etc. And CPAP hasn't helped. What are some helpful tips when your partner is keeping you awake?
Well, the silence might mean that there are very few great options. But just starting with the basic, I myself use earplugs, and that's not a bad thing. It cuts a certain decibel level range it takes it out of the hearing window, and using other forms of noise to drown out noises that you don't want. So a fan even, or a white noise machine could be helpful. Some people consider sleeping in a different bedroom altogether, which is obviously a discussion you then have to have with your partner.
All right, I know that that's a tough one. Oh, does anybody have anything else?
No, I was going to say that those are really the things that came to my mind as well. It can be a tough situation, and unfortunately, sometimes removing yourself from the thing that's keeping you awake can be a very effective approach, notwithstanding the the potential downsides from the relationship standpoint.
Thank you. Our next question, Kevin, I'm going to throw this one your way. I was recently diagnosed with sleep apnea, and sometimes I have a fear of contracting Legionnaire's disease from using the machine, the CPAP machine. Could you talk about the risk?
Yeah, I'll weigh in a little bit, and I'll let the doctors on the call as well weigh in from their experiences. But from my experiences, I've not come across this. So I think the risk is relatively low. And I know a lot of manufacturers out there with CPAPs often recommend using distilled water to fill up your humidifier. So if you're using distilled water, if you're keeping your device clean, following the cleaning instructions, the daily, the weekly, the monthly, as long as you're cleaning your airflow, changing your filters and things like that on a regular basis, and taking care of your mask and taking care of your tube, then I think the risk is very low.
Yeah, I agree with that. I think proper cleaning the device is important. That said, I think that infections contracted from contamination of the device are exceedingly rare. I'm not sure that I've seen one in 30 years of doing this. I think the one thing, though, I might add is that sometimes, particularly when humidification is not adequate, the CPAP may contribute to nasal congestion and poor sinus drainage, and so I do think that occasionally sinus infections may occur. Although most of the sinusitis that we see in that setting is non-infectious, but that might be the one infectious thing. It's not coming from the device. It's that as a consequence of the drying, there may be poor drainage of the sinuses.
Thank you so much. This is a really great question. When is the best time to exercise to help with falling asleep?
The data on that are fairly limited, but the limited data that exists suggests that late afternoon or early evening may be the best time to exercise from the standpoint of improving sleep quality at night. You don't want to exercise within the last several hours before bedtime, because what happens is that raises the body's internal temperature and makes it harder to fall asleep. But as the body cools, it becomes easier to fall asleep. And that's the reason why it's thought that the late afternoon or early evening time might be good, preferable for improving sleep. That said, I think that exercising any time of day is good. Whenever you can do it, it's aside from shortly before bedtime, is worth doing. If you can do it at a consistent time from one day to another, that's probably also a good thing, because it's one of the things that regular activity pattern is one of the things that helps to strengthen the body's internal clock. So I think that if the morning is an easier time for you to exercise than the evening, I think exercising regularly in the morning is preferable than to trying to switch to an evening bedtime exercise time.
Thanks for that. Next question is, how can you reset when you wake up in the middle of the night?
Another great question. So for me, one thing that's important is to remind myself, and I have our patients do this as well, that it's quite normal to wake up during the middle of the night. What's not normal is to stay awake for an extended period of time. So if you're someone that happens to wake up and go, oh my gosh, I woke up again, what's going on? We try to remove that self-imposed stress and frustration from the equation by maybe just telling yourself it's okay to wake up. So that's number one. So if that's not helping, and doing that consistently is not helping, then actually removing yourself from the bedroom for a period of time until you're sleepy again. And that could be half an hour, it could be 45 minutes, in some instances a little longer. But removing yourself from the bedroom, and then do what? Well, do something that's not too active. So don't go for your 5-mile run at 3 o'clock in the morning either. But instead, reading a book in low light might be a nice sedating activity to do, and then return to bed.
Yeah, I would reiterate that, and also add that the goal is that ultimately you'll be able to fall asleep more easily by doing this, so that you don't expect that every night you're going to have to get up and spend an hour reading in low light. You're going to break that cycle of waking up and being anxious about not being able to get to sleep, and that's going to make it easier to more often simply go back to sleep without getting up.
Thank you. Dr. Pigeon, you're going to have optometrists everywhere angry at you for your low light reading suggestion. All right, our next question is, can weight loss impact your need for a CPAP device?
Absolutely. Many studies have shown that weight loss will improve the severity of sleep apnea. And every year I have several patients who no longer need their CPAP at all because they've lost sufficient weight that their sleep apnea has resolved or reduced to a level that it's no longer causing symptoms. And that's been shown both with dietary, weight loss through diet and exercise, and weight loss through other means such as weight loss surgery. And the amount of weight that you need to lose is varies quite a bit from one individual to another. So that in some patients there's a sort of a threshold above which their symptoms get a lot worse, and there are others who the more weight they lose, the more their sleep apnea will improve. But for most patients, weight loss will improve the severity of sleep apnea.
Great. Our next question, can you talk about Inspire as an alternative to the CPAP machine?
Yeah, so Inspire is a trade name for one of the hypoglossal nerve stimulation devices. And as I said earlier, that nerve is one that innervates the tongue and stimulates the tongue to move forward. And it's activated each time we breathe in to help prevent the airway from collapsing. What the hypoglossal nerve stimulation does is to identify. It's like a pacemaker that's inserted in the chest, usually on the right side, so that it's not confused with a cardiac pacemaker, and it's got a probe in the chest, so it can identify when a person takes a breath because of the change in pressure, and that causes the device to stimulate the nerve, the hypoglossal nerve, which is in the neck, to make the tongue protrude. And it can be very effective in some patients for controlling sleep apnea. That said, it's a fairly small minority of sleep apnea patients in whom it's effective. It's generally recommended for patients who are overweight or only mildly obese. It requires a look at the upper airway under anesthesia to look at the pattern of collapse of the airway during sleep apnea, and only depending on that pattern, that will tell us whether or not the device is likely to be effective. And so that also further limits the number of patients for whom it's available. And then it requires a surgery, which includes not only the placement of the pacemaker in the chest wall, which is not a big operation, but it does require cutting into the neck and identifying the appropriate nerve, and that's a little more of an involved procedure. So in general, this would be sort of in most patients, a third line type of therapy for patients who don't tolerate the simpler approaches such as CPAP or an oral appliance, although it is appropriate for some patients.
Thank you. All right, our next question. What can I do when my CPAP doesn't work?
Well, I think it's important to try and identify why it is that it's not working. CPAP can control obstructive sleep apnea in the vast majority of patients. And so if it's not working, the question is it not working because it's not controlling the sleep apnea, in which case it may be that the pressure settings aren't correct, that there's excessive leak from the mask, for instance, or that it may be that in some instances it's not obstructive sleep apnea, but central sleep apnea, for instance, and a different type of positive pressure device may be necessary. So, so those are things that need to be looked at on an individual basis to identify what's causing it to not work. Now, another reason that I'm sometimes told my CPAP isn't working is that a patient came for evaluation because they were overly sleepy. They were found to have sleep apnea, and their sleep apnea was treated with CPAP, but they're still sleepy. And there are many reasons why people may be overly sleepy. Sleep apnea is an important one, but it's certainly not the only one. And so I think it's important to look at whether what's not working is that the CPAP isn't controlling sleep apnea, or that there are other problems going on contributing to symptoms other than sleep apnea, and then to address those appropriately.
Great. Kevin, do you want to add anything here?
No, I think Dr. Godley talked, at first I read the question, I'm like, is this an operational doesn't work, or is it a clinical doesn't work? So I was going to err on the clinical side as well. So I think all the things that Dr. Godley talked about was just to make sure you follow up with your physician. As he alluded to earlier on, physicians can now take a look at your device remotely. So they could tell you how many hours a night that you're sleeping, how much leak that you're getting from your mask to see if that's causing an issue, and then monitor and adjust on the fly remotely. So I think it's always good in these situations to refer back to your physician, and then they can make their recommendations on what they can do to help intervene to help you get back on track.
Okay. Kevin, I have a follow-up question here about the machine. It says, I have pretty bad sleep apnea, but when I wear my mask, I always take it off during sleep. Any suggestions to keep it on?
Yeah, I mean, from that instance of, is the pressure the right pressure for you? Is it too high of a pressure? Why is it falling off, or are you taking it off? So is it fitted properly for you? Those type of things would be something to address. There are different things that can go on certain masks that kind of go around the jaw that could kind of keep it on a little bit more securely. So I would take a look at just making sure that the mask is fitted properly for you, that it's the right size. If you're pulling it off versus it just falls off because you roll over or do something along those lines. But I would start with the simplest things first, but they do have headgear attachments that kind of put it, especially if you're an open mouth breather, to help you close your mouth and maybe keep the mask a little bit more secure for you. You don't want to over tighten it because that will have, negative implications too, possibly with leak. But any of the other, physicians on the call may have other recommendations for their patients.
Yeah, I think those recommendations are great. A couple of other things that I would mention is that especially early in treatment, sometimes just being unfamiliar with the mask can cause a person to remove it. And as Dr. Pigeon indicated, it's normal to wake up during the night. Usually, if you're not awake for at least several minutes, you don't remember being awake. And so it may be that a person wakes up and they have this unfamiliar thing on their face, they take it off and fall back to sleep, may not remember doing that. So sometimes they don't know whether it fell off or they took it off. But that's most common, I think, right, early in treatment, and sometimes doing some awake desensitization to the mask, as we would do if someone felt anxiety when they first put the mask on, may be helpful, just so that when they wake up at night, it's not a strange thing. The other, another thing that I always look for is to see whether perhaps the pressure range is too wide, so that it may be that the pressure is too low early on, and as a result, there may be apneas occurring, and that will cause people to alert and take off the mask because they feel like they're not able to breathe. And so sometimes adjusting the pressures can help as well.
Thank you for those tips. Our next question, what options are available for individuals with chronic pain, pain from arthritis, or those who wake up in pain?
So some of the approaches to pain management, if that isn't something that you or others like yourself have already tried, can be quite helpful. So there are pain management programs that can assist with reducing pain a little bit, but also decreasing the impact that severe pain can have. So this person will know that pain has quite a negative impact on sleep. If that impact on sleep is causing insomnia, then treating the insomnia can also help with the pain. So when we improve one thing, it's often the case that other things improve. That's the case both with pain. So if pain is better managed, sleep will improve a little bit. And if sleep is a problem and sleep is improved, then your ability to manage your pain can also improve. I'll mention that for a lot of pain patients, a side effect of chronic pain is weight gain. And sometimes the medications that are used to manage pain can also contribute to tipping someone over their threshold into sleep apnea. So sometimes combined new medications with weight gain. If you haven't been assessed for sleep apnea because you didn't think you had it, it could be that you may now be on the borderline or have developed sleep apnea. It's worth checking that out as well.
That's a great point for people's health. Thank you. Our next question is, what are options at the VA for narcolepsy and apnea combined?
Well, I think that it's not uncommon for people with narcolepsy to have sleep apnea. I think the treatments are not really different for either condition than they would be when they occur alone. That is, the same treatments for sleep apnea are going to be effective for controlling the sleep apnea, although people may not get the symptomatic benefit that they expect if they have narcolepsy, which will cause excessive sleepiness regardless of the presence or absence of sleep apnea. So typically we will treat the sleep apnea and also treat the narcolepsy. Now, there's no cure for narcolepsy, but there are a number of medications that are used to treat the symptoms. And the main symptom that is experienced by everyone with narcolepsy is excessive sleepiness. And there are several alerting medications that can be used to treat that. And there is one medication that's not an alerting medication, but that called sodium oxybate that works through mechanisms that are not well understood, but it does increase sleep depth and reduces daytime sleepiness. The other main symptom of narcolepsy is the other main symptoms of narcolepsy, I should say, are related to facets of a rapid eye movement or REM sleep intruding into wakefulness. And one of the things that happens during REM sleep is that we dream. But another thing that happens during REM sleep is that our voluntary muscles are paralyzed. We don't act out those dreams. And that muscle paralysis can occur abruptly and unexpectedly during daytime, often triggered by emotion. And when that happens, there's a loss of strength and the person can fall down or need to support themselves. And we call that cataplexy. And that can be treated in different ways. Again, that medicine that I mentioned, sodium oxybate, is effective for treating cataplexy, as are a number of antidepressant medications that can suppress REM sleep and prevent that symptom. Another common symptom is sleep paralysis, where a person wakes up and they're awake, they're aware of what's going on around them, but they can't move. And it can be very frightening. It's experienced occasionally by about 10% of people. It's experienced frequently by many people with narcolepsy. And occasionally it's a bothersome enough symptom that it needs to be treated on its own. And the same medications that treat cataplexy will generally control the sleep paralysis.
Thank you. That was really informative. Our next question is, I recently purchased and sleep on a 7-inch sleep wedge, which elevates my head above my feet in a slow grade over the length of the mattress. What's your expert opinion on this sleep alternative option? As a testimonial, I feel like I'm sleeping better and my husband snores less.
Well, I will say that in general, when a patient tells me they're doing something that helps them to sleep better, and there's no apparent harm to it, I'd say that's great, keep doing it. Now, why might if I were to try and answer why this might help, there are a couple of things. And one is for patients who have gastroesophageal reflux or GERD, that can be helped by elevating the head. And so that's one way that it could be beneficial. The improvement in snoring is, certainly when you're lying on your back, gravity will tend to pull the tongue back towards the back of the throat and contribute to snoring. And so elevating the head of the bed changes that gravitational effect modestly, I would say, if it's a 7-inch gradient over the course of the bed, but that may have some impact on snoring as well. So those are the things that come to mind as possible explanations for why it helps with sleep. But I can't say that I know for sure.
Okay. Here is an interesting question. What's the difference between a CPAP and a BiPAP machine?
Okay, well, the main difference is that in a CPAP machine, in general, the pressure is the same both during inspiration and expiration, inhalation and expiration, with some minor modifications. With a bi-level positive airway pressure machine, the machine senses when you breathe in, and not only increases the blower speed to maintain to prevent pressure from dropping, but it actually increases the pressure by a certain amount. So that there's a higher pressure when you're breathing in than when you're breathing out, and that. In general, I would say is not necessary for most people with obstructive sleep apnea, although at higher pressures, some people do find it more comfortable, especially if they feel that it's difficult to exhale. And so that's one setting in which we'll recommend a bi-level rather than a CPAP machine. A more common setting in which we use the bi-level machines is for people who have other disorders that impair their ability to ventilate. So some neuromuscular diseases, for instance, this may provide a non-invasive ventilatory support. Sometimes in patients with chronic obstructive lung disease or COPD, those bi-level machines can be helpful. Those are the typical scenarios in which we would recommend a bi-level machine rather than a CPAP machine. Kevin, do you have any other thoughts about that?
No, I think Dr. Godler, you spoke, to all the main points. It's usually for people with higher pressure settings, but it is, these machines are learning your breathing patterns, using algorithms to know when to give you the pressure you need to open your airway. So when you're breathing in, and it knows when to back off, so when you're breathing out to make it a little bit more comfortable. But usually the people with the higher pressure settings need that. And to your point, there are devices out there for people with restrictive disorders, neuromuscular, servoventilation devices. So those are the ones you'll see that the algorithms change a little bit for the people with complex central sleep apneas, COPD. So they're a little bit more specialized, a little bit more involved. Yeah, basically those are the main differences between CPAP and BiPAP.
Thank you for clarifying. Really great information. Our next question. My wounded warrior is prescribed Benadryl as a first line of defense against agitation, as well as to help him fall asleep in conjunction with his regular medications for bipolar disorder. This has been very helpful. Should we be concerned about his body becoming desensitized to the effects due to long-term use of Benadryl?
You're muted, Will.
Apologies. In regards to Benadryl's use for sleep, it's a valid concern that it might lose some efficacy for sleep. Typically, folks recommend that people using Benadryl for sleep use it for a handful of days and go off and then come back on after a period of time. I'm afraid that's the extent of my answer.
Okay. Well, thank you for that. Our next question is, my high anxiety level is contributing to loss of sleep. How do I fix this?
Yeah, well, if it hurts when you do that, don't do that. So it's tough. So indeed, anxiety can contribute to poor sleep. So how does one manage anxiety? There are a couple things that, or several things that people have used to manage anxiety. Those can be a full-on course of anxiety-reducing treatment. There is a non-medication and medication approaches to treating anxiety, which providers can point you to. In addition, a variety of relaxation exercises can be quite helpful. So, and that is a long list. I tend to tell folks to just pick what they think might work. So if that's going to be yoga, yes, try yoga. If it's going to be mindfulness meditation, try that. Guided imagery, but any from a long list of things that essentially decrease arousal, diminish anxiety, and promote relaxation can be helpful for the anxiety and also therefore helpful for sleep. One thing that folks often do is try to implement new stress reducing or anxiety reducing activities right before bedtime, which on the surface makes sense, but it's really best to try to learn a new strategy like that somewhere else in the day, morning, afternoon, or early evening. What tends to happen is that when we're learning a new activity, it can be stressful to do so. So then it has the opposite effect. We're stressed that we're not doing it right. And now I'm more aroused at bedtime than earlier. So learn the strategy. And then once you've got it down, applying it when it makes sense for you.
Thank you so much, Dr. Pigeon. And with your mention of yoga, I will do a plug here for Elizabeth Dole Foundation C3 series focused on yoga. We do this in conjunction with Yoga for Caregivers, and our next episode is on June 8th at 1 p.m. I encourage you all to attend, and there'll be a link to register out in the chat box there. We have time for about 2 more questions. Our next question is, I fall asleep in the daytime, but only for 20 minutes, and then I cannot sleep at night. Why is this?
Well, we have a very well-regulated sleep mechanism, and one of the major inputs is a little thermostat, a homeostat that keeps track of how much sleep we've had over the last 24 hours. So each time we essentially drain that sleep drive tank, that level of sleep drive is not available for us in the evening. So 30 minutes doesn't sound like a whole lot, and yet a 30-minute nap can cause us to feel more refreshed. That's a good thing at 4 p.m. It's not a great thing to feel very refreshed at 11 p.m. when you're hoping to go to bed. So I would experiment with potentially avoiding the nap or setting an alarm for maybe even 20 minutes and seeing if that has an impact.
That's a really great tip. So our final question of the afternoon, I've gotten lots of questions in the chat about this, and so I'll summarize them as best I can. What about melatonin? I've heard good things and bad things. Can you give us some advice?
I think you'll get 2 answers. So the first is melatonin is very helpful for people who have problems with their circadian rhythm. They either wake up way earlier than they intend, or they fall asleep way earlier than they intend, or folks who suffer from jet lag. So the best use for melatonin is to alter the sleep clock in a fashion that's helpful. In terms of helping us fall asleep, if someone's going to use melatonin, it's best to use it early in the evening, not right at bedtime, and to use a very low dose, somewhere between even something like 0.5 milligrams to 1 milligram, which is hard to find over the counter, but nonetheless, the lower the better.
Yeah, I agree that melatonin's most well understood effects are on shifting the body's internal clock to an earlier or later time. It is a relatively modest sedative. I think it is generally safe, and when I have patients who are using it whilst in sleep, I don't discourage them from using it, and because it is relatively safe, I think for patients who want something in addition to the non-pharmacologic approaches to insomnia, I will often give them a prescription for a fairly low dose of melatonin as well, typically a 3 milligram dose. There are some other sleep disorders for which melatonin can be very effective. For instance, a disorder in which people act out their dreams during sleep. Melatonin in somewhat higher doses can be very effective. And so there may be other reasons besides insomnia, but the one that most people are using it for is for insomnia, and I think it has modest benefits, but not a whole lot in the way of risks associated with it.
Thank you so much, Dr. Gottlieb. And thank you to all of our panelists today for making the time to be with us. A recording of today's webinar will be available and shared on our YouTube channel, and that link will be thrown here in the chat. If you weren't able to join on April 22nd during our first episode, I encourage you to watch that video as well. That can also be found on our YouTube channel. I apologize that we can't answer all of your questions today. We had so many come in, which is great. So I'm really glad we were able to do this program. And thank you all for the interest and the participation. I'd also again like to thank our sponsors and partners, Philips and the Veterans Administration. If you enjoyed today's webinar, again, just check out our YouTube page for past webinars and help with topics like telehealth, rural health, and whole health. The Elizabeth Dole Foundation is also excited to announce that our second annual Military Kids Have Talent program submissions are now open. If you know a military child, please encourage them to apply. Top prizes include a family vacation to Universal Studios in Orlando, Florida. The deadline to submit is May 28th, so it's coming up. The website link is also in the chat feature below. Okay, again, thank you all for attending today's session, and I hope to see you all at the next Spotlight series. Have a good afternoon. Bye.